Hi, I'm Dr. Deborah Hodesson of All Pet Smiling Veterinary Care, and this is my mobile clinic. And this is my dog Skana. So he's just kind of hanging out. But I wanted to talk to you today about why it's so important to see your veterinarian every year. And there's a lot of hidden diseases that can happen that you think they might be okay, but they're not. And as they get older, it's even more important to visit your veterinarian and even have some tests run to make sure their kidneys are okay and their liver's okay. But when you first go into your veterinarian, they're going to want to do a complete exam on your dog or cat or ferret, whoever you happen to be taking in. And you'll basically want to watch them as they examine your pet and mention anything that might have you've noticed, like has there been some little bit of discharge from the nose or the eyes, or one ear looks a little bit lower than the other because they might be holding it kind of funny if it's bothering them. And your veterinarian will ask you a complete history too. So they'll start from kind of the tip of the nose and go all the way down to the tip of the tail and check everything. And this is like an ophthalmoscope and an otoscope. And that was a good burp. And check inside the ears. And one of the most important things to do is also look inside their mouth, because it's very difficult sometimes when they're moving all over, and take a look and make sure their teeth are nice and clean and the gums are nice and pink. If they have pink gums and there's no disease or any smell from there. And same thing with the ears. They'll look inside there and use the otoscope to look down in it, see if there's any bad odor coming from there, discharge. And then Skana has some lipomas on him, and so same thing with your pet. They'll want to check them over and see if there's any growths. And then we listen with our stethoscope to the heart and the lungs, and palpate, which means kind of feel their abdomen and see if there's anything. Does it bother them? Does it hurt? Does it feel full? Is there something inside there that doesn't feel right? And then we do a lot of times do an examination rectally to check and make sure there's no growths or abnormalities there. And of course we always check their heart rate, their respiratory rate, their pulse, and their temperature. So that's kind of what constitutes a complete exam. And after that, your veterinarian will want to talk to you about some recommendations depending on what they find on the physical examination and your history that you've given them, and go from there. So thank you.